Hello and welcome. If you're a certified medical examiner, this explainer is for you. We're going to dive into the rules that are really the foundation of your job. 49 CFR Part 391. Think of this as a practical guide to help you feel confident and clear about your critical role.
Every time a driver sits in your exam room, you are, quite literally, the gatekeeper of highway safety. The decisions you make matter a lot. So the big question is, what do these rules truly require of you day in and day out? Let's get into it.
Okay, so let's start with the basics, the absolute foundation of every single exam you do. This is all about your core responsibilities, straight from the regulations. When you boil it down, Section 391.43 says your role is built on 4 pillars. First, you've got to conduct a really thorough physical exam. Second, you dig into that complete medical history. Third, and this is the big one, you make the final call on certification. And fourth, you report those results to the National Registry. It's a clear step-by-step process. Now, let's talk about the certification period. The max, as you know, is 2 years. But, and this is so important, this isn't a one-size-fits-all rule. Your professional judgment is key. If you have a driver with a condition like hypertension that needs a closer look more often, you have the full authority to issue a certificate for a shorter time. That flexibility is built right into the system for safety.
All right, let's move on to one of the most common and sometimes complex cases you'll see, drivers with insulin-treated diabetes, or ITDM. The FMCSA has some very specific rules we need to follow here.
And this is where we see a real partnership, but also a really clear line of responsibility. The driver's job is to get you that completed MCSI 5870 form from their own doctor. But your role is so much more than just taking that paper. You have to evaluate it, look at all the info, and decide for yourself if that driver's condition is truly stable and well managed. The final say is always yours. So when you're looking at that ITDM driver, here are the key things to remember. The certification is for 1 year max. You need to see proof, actual documentation of consistent blood glucose monitoring. And critically, you have to verify that they haven't had any recent severe hypoglycemic episodes. It's all about having that proof of stability. Let's switch gears to another important scenario you'll definitely see. Drivers who have limb loss or an impairment. It's not an automatic disqualifier. The regulations lay out a very specific path for these individuals. And the key to this whole thing is something called the Skill Performance Evaluation, or SPE. Now, this isn't a test that you give, but you absolutely need to know what it is. The SPE is a special test given directly by the FMCSA to make sure a driver can safely operate their truck, sometimes with things like prosthetic limbs or special equipment. So picture this. A driver with a limb impairment walks into your office. The question isn't if they can be certified, it's how. And the answer isn't just a no, it's the SPE process. And the process is actually pretty straightforward. First, the driver applies to the FMCSA for an SPE. Then, the FMCSA does their evaluation. If the driver passes, they get an official SPE certificate. They bring that certificate to you, and it becomes a really important piece of the puzzle when you're making your final decision. Okay, let's talk about a situation that can be, well, a little awkward. Resolving medical disputes. What do you do when your expert medical opinion about a driver's fitness is different from what their own personal doctor thinks? Well, the good news is you're not left to just argue about it. The regulations give us an official pathway in Section 391.47. If there's a disagreement, the case can be sent to the FMCSA. They look at all the medical evidence from both sides, and then they issue the final binding decision. It's a process that protects everybody by bringing in an impartial third party. And finally, let's just clear something up about special exemptions. You hear a lot of things out there, so it's super important to know which rules are still in play and which ones are basically history. Here's the bottom line. That intracity zone exemption, yes, it's still active, but it applies to a very, very small group of drivers. But that whole grandfathering rule you might hear about, it is completely defunct, gone. So if a driver says they're grandfathered in, you know they still have to meet today's medical standards, period. This quote really sums up the whole spirit of the regulations. Safety is number one, always. But the system is smart enough to have flexibility, to have these structured, fair processes like the ITDM evaluation and the SPE certificate to look at each driver as an individual. Ultimately, these regulations aren't just a bunch of rules you have to memorize. They're the tools that empower you to make good, solid, defensible decisions. Every single certificate you sign is a statement you're making about public safety. Thank you for taking that responsibility so seriously. For more information and resources to help you in your practice, please go to expressphysicalsllc.com.